Hello, everyone, and welcome to the show. Welcome to Create with Franz, Sidney, and today, as our honor guest, all the way from Virginia, Shaji Nair. Hello, Shaji.
Hey, Franz, how are you?
We
Good
are
morning.
so good and excited to have you here. And let's introduce straight off a topic so you know that you're going to have to hang out and listen very carefully to this super interesting episode. Because today we're going to talk about a different type of topic. We've been focusing for the whole month about AI and how that's going to change our life. Also, because a lot of people are getting increasingly frustrated and worried that they don't really know what's going on. It's a bit like when internet came out in the end of the 80s and beginning of the 90s. Everyone was like, oh, internet, what is this? What do I do? And now AI, which has been around for a long while, is becoming more prominent. And one of the things they will do is change the way we act in daily activities. So from a bank to the shopping and even to medical care. And people are now worried. I hear my older friends saying, Franz, we're going to have a robot looking at us instead of a doctor. I want a real person. But it's not going to be like that. But the main problem is when it comes to healthcare, why do we become anxious? First of all, because we don't know how to prevent. We arrive to the doctor, to the dentist, to the chiropractor when the problem has already happened, when there are symptoms. That means the problem has been going on for a long while, in many times, unless it's an emergency. And then we have a problem that when we want to get to the doctor, it's so hard to find one because, let's say, all medical professionals are working 60 hours, 80 hours weeks, 100 hours. They're just crazy tired. They're full, they have paperwork. In the US, they have insurance issues. And everyone is just running around. So there isn't much time for a consultant to sit with you, to talk, to analyze what you've done 10 years ago, how things are changing. They just don't have the time. And I've always thought, how do we solve this? Because this is causing being tired, being frustrated, being anxious, and just saying, you know what, I'm just going to let it go because it's impossible to find care. And when I do find it, it's going to be expensive. So I've been talking about all this problem with Shaji because he has a background as an engineer, but he's really a health tech expert based in Virginia. And what we do, they use AI to help doctors, nurses, consultants to be less overworked. How does this work? We're going to see as we go forward. But first of all, let's see what happens about the healthcare and what are the main problems that you, Shaji, you can see here in the US when a person wants to access a point of care and finds it very, very difficult to do.
Well, thanks, Franz. I think some of the challenges you did highlight in your introduction, which is either the access, availability, the knowledge, continuation of care, and all those touch points a person has with the health system is very complex, layered, depending on the city, depending on the state, which part no you live, and which specialist, which insurance you have, right? So many of those regulations and so many of those layers. And on top of it, lack of resources. We can't produce enough doctors, we can't produce enough nurses, so the resources are tough to come by. So we are on I can understand a lot of people, either skeptical or pro AI, but we are on the good side of AI. We are leveraging the power of AI to see how do we augment care coordination, how we provide education, resources, and intelligence both to the patient, the physician, nurse practitioners, or within the healthcare delivery models. And so our build at HFWL company, our platform is called Friska.AI. Friska is a Scandinavian name for healthy. And so we thought we will leverage that kind of a thoughtful approach to healthcare from Scandinavia into how we built AI capabilities. And so as U.S. healthcare expenses last year crossed 5 trillion, which in nominal terms is bigger than the German GDP. But US has one of the poorer outcomes. It's not that it's spending a lot of money, but it's not getting the returns either. So we looked at all the spaces within the healthcare delivery models to understand where are the roadblocks, right? Even if you get a care, you have access, very good insurance, you go to the doctor, and the doctor can spend maybe 7, 20 minutes with you, depending on the kind of insurance you have and the care. And doctor tells you, do this is your treatment plan, A, B, C, D, and you come out and suddenly you are left with this list of items to coordinate your lifestyle change, what you want to eat, what is good for you, what's not good for you, what kind of fitness activities, how to manage your stress, how to manage your sleep. And then you can get a consultation, maybe one or this month, or maybe one next month, or depend, and this week. Then how do you follow up through that? Do you go to the gym every day, or do you do from home? Who's going to coordinate with you? So Friska.AI is providing capabilities to coordinate on behalf of the doctor to help the patients to continuum of care, helping them manage what the food they eat, what meals they should eat based on their day-to-day health condition, how to change the meals, how to change your activities, how to manage your stress, how to plan for your sleep, but also for the doctors to provide intelligent data to say, okay, who among your patient is at risk, so that they can focus on patients who are more at risk, so that it's preventive, it is continuation of care, but no building AI capabilities to augment healthcare workers.
Well, thank you. That makes sense. And of course, it's a very complex field. I don't even dare trying to think about solutions, but certainly we need people to be able to access this care. And all of it starts with prevention and then lifestyle medicine, which is so important. We can't really expect to live an unhealthy life, which sounds different for every person, and then be healthy in the end. So the doctor is there and he has that amount of time. But what if we have a little bit more help to get to the crutch? What is the root cause of my issue? How can I change? For example, I don't know, maybe you're feeling very stiff and your muscles are not well, you can't even breathe properly, and you think that's I'm aging. But actually, maybe it's because you're just sedentary. So a doctor that can see all your papers and is working with AI and working with his brain, he can see and say, oh, there is something here in your lifestyle that you can bring in and change, and we can lay out this or lay down this plan so you can get better and faster. In fact, it's been proven even people undergoing gruesome therapy like chemotherapy, etc., they are much better if there was certain types of lifestyle that was introduced before, so their body reacts in a much better way. And so there is this problem that when we need care, sometimes we don't know which specialist, who is in charge of what, who does what, who pays for what. It's just such a nightmare. And is there something that can be done to clarify
Yeah.
who's responsible, for example, for prevention?
Good question. I mean, we ourselves are the primary responsibility for prevention, right? And the doctors are the next, the medical professionals are the next line of prevention. First is us. And so some use case, I can explain you one use case, for example, is that let's say you have a doctor's appointment. You go to the doctor's office, you wait in the waiting room, and there is a physician assistant comes and says, okay, Franz, you come in and they ask you the questions like, what's been going through? What is your reason for a visit? And you might say, okay, I have a back pain, or I have no stuffy nose, or whatever those conditions you are explaining to them. And that's like 2 to 3 or maybe 5 minutes. They are capturing information from you, getting a weight, getting a blood pressure. Maybe if somebody has diabetes, they are taking no measurement from to ask them the question, or if they have a CGM, they get the reading. So this is the 5 to 7 minutes. And then based on that, what the doctor would just give you a treatment plan or a diagnosis, right? So what we did in our case, what we studied throughout this example is patients within that 5 minutes might not have the time to explain all the conditions they went through, whether it's the last 3 months, last 6 months, or their entire medical history to recite. But what if we provide that capability for the patient to do from home, right? So they can take time, 1 hour, 2 hour, 15 minutes, 5 minutes, talk to an AI, tell the AI, like you talk to a physician assistant, what you've been going through, what's the reason for your visit, what health conditions or what challenges you're facing, what's been your health history, who else you saw, and all this data the AI processes, and then AI uses that data to generate recommendation both to the patient but also clinical notes to the physician. So physician, when they are seeing the patient, whether the next day or the following day for an appointment at the office or telehealth, the physician has more intelligent, more input from the patient so that they can provide more personalized care and again use the same system to generate personal care coordination for them. And so primary care is at is preventive care is at the person's hand. So if you can empower the patients, the tools, capabilities to manage their health, provide intelligent tracking, intelligent coordination, intelligent alerts on a daily basis, it should start from the patient before it goes to the doctor. So our methodology, our thing is to empower the patients to handle their preventive care in their hand, but when it's necessary, they are being consulted by a specialist, and obviously the AI can suggest which specialist they should see. Because it will triage based your information, whether it's the wearable data like Apple Health, Google Health, or continuous monitors like CGMs, glucose monitors, or manually what you enter. AI will recommend you the type of doctor or a type of specialist you need to see, what kind of actions you need to take, and is it a very emergency situation or something you can wait for a week or 2 weeks to consult a doctor. So the AI starts to become, give your personal companion or health companion for you.
Well, thank you, Shaji. That makes a lot of sense because I was just thinking about that. If you are taken to hospital in, I don't know, hypoglycemic coma, but nobody knows that you're
Right.
diabetic, and you arrive there, and somehow you've managed to connect them to your name, who you are, and if
Yeah.
there is a database where the paramedic can access that, they can say, "Oh my gosh, this person needs insulin, adrenaline, whatever we're gonna have. I'm not gonna pronounce what we need, but they know what to do. But maybe their medical care will also say, beware, this person is allergic to so and so, or has a genetic predisposition, their methylation is not very good. So they're not going to get rid of anesthetic, they're going to be drowsy. So all this stuff together with an AI to help should, in theory, help people to be enjoying a more personalized healthcare, which in some cases could actually save a life.
Yes, of course. And it's also we typically say even if you can extend somebody's life by a few years or give them healthier, happier, life, that's goal achieved, right? From a doctor's view or from our view or even from a patient's view or their family. But it is also important that the patient sees many doctors, many specialists. Could be an ophthalmologist and they are having an eye issue and they are giving them eye drops. Could that eye drops have steroids? Could that counteract with some other medication that the patient is taking, whether it is for mental health or other physiotherapists? How do you know all these side effects to the patient, right? So we wanted to do is the Friska.AI becomes as your centralized, intelligent, personal care, personal health consultant in your hand that brings all this data from all your physician into a central repository, gives you guidance, but also gives you the ability to share that information to any physician or specialist you go to so that they have a wholesome view of who Franz is or who Shaji is, what treatment they are going through, what's been their health history, what medication they are taking, what could be the side effects, and it will pop up. It will help the doctors to prevent prescribing wrong medication or to give them the ability to suggest lifestyle changes that are more personal.
That makes sense. Thank you. And one more question. obviously there are serious concerns about privacy and data leaks. So if a person is already concerned about his own data being held somewhere, with AI, is there any further concern that we should be worried about? Or the system is already designed to keep their privacy in mind? Should people not want to be in the database?
Oh, good question. So we start our company when we started with a fundamental policy that the data, even though it's not legally, except New Hampshire has a kind of law which says that health data is patient owned. In our case, we have a base philosophy that every data the patient generates is owned by the patient. So the patient owns the data. Patients has the right to share it with who they like, whether it's to the physician or to their relatives, depending on their own choice. Right? And we obviously designed the whole system on HIPAA compliance, infrastructure, and all those security. And we made a policy decision. The data is going to be seen only by the patient and the relevant doctors with the permission of the patient. Always patient can give access to the physician for a time for that day's consultation or continuation, let's say for a period, or they can give them for continuation open-ended access to their data and they can always close down. Right? And so the data is owned by the patient controls who has access to it, and patient can determine or provide or revoke access to their data. And it is always, the rule is it's patient and their providers.
I'm satisfied to know this. And then people can make their own decisions, of course, as AI become more pervasive. And of course, AI is everywhere. And robots are everywhere. I was reading just yesterday about a surgeon in the States who performed an entire operation on somebody in Africa through using robotic arms and a video. He was doing I can't remember the operation. It was on mute and what type of surgery it was. But isn't that amazing? We can use this knowledge. And without having a person right there, we can actually operate.
True, true. Some of these technology has been there in the manufacturing sector for quite a long time. We worked with some manufacturers where you could have a remote diagnosis for a heavy CNC machine or something so far off. You don't want to send your technician from US to, let's say, for example, Singapore or Australia or even to Malta or somewhere to fix the machine. You can do from here. All you need is a local operator. They don't need to know any machine. You will have a coordinated fix. So this has been there for decades, but now those use cases are coming into the medical field, from industrial and manufacturing and technology to healthcare. Healthcare, in my view, has been the relatively the slowest adapters of the latest technology. For obvious reasons, it has a lot of regulations. And it involves people's lives. Unlike like a manufacturing, you make a piece of equipment. Here you're treating a human being, so there are stricter regulations and what you can do, what you can't do. So it's later. The healthcare tend to be one of those later part in deployment of technology. We expect going to be more innovation coming up within the healthcare delivery models in the coming decades. And it's going to be transform healthcare the way we know it. It's going to change the delivery models. You can take my word for it now, and we can talk about it in a few years. Most of the primary care, at least in US or developed countries, will be AI. You don't need primary care doctor because the AI can do this more intelligently, more accurately than most of the current doctors.
So this is a debatable point for a lot of people. They think, I want the real doctor. But the real doctor is a person and he has that kind of intelligence and experience and a human connection. The AI, which is growing and doubling in power every year, we now have maybe the human connection, which you want, but absolutely will have a lot more intelligence And we'll be able to remember a lot of stuff as it they get better and better and their hallucinations decrease, because AI can give really weird answers sometimes.
Oh,
But we
yeah.
are getting better. And eventually, hopefully we won't hear anymore, as you can read like in the Daily Mail and whatever British press that I remember reading, like doctor dismiss patients thinking he only have a little stomach upset, and it turned out it was stage 4 cancer. This ought to really end. Or I thought it was just an allergy and it was cancer. Because the doctor is there, he cannot know every single disease in the world. Sometimes it's a very rare disease. Sometimes they are not connecting the dots because they don't have time to look through pages of notes. The older you are, the more notes you will have, but just don't have the time. So they may not connect what you have. So AI can be a tool. It can be disruptive in certain areas, and it can be very useful to get to that diagnosis. Then you can always challenge it and say, there's something wrong here, but at least the doctor will have this. It's like an extra brain there.
True, 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 very true. So I see, well, one number, like there are the largest expense in US healthcare goes towards chronic condition, comorbidities, either the treatment of it or no complications from those comorbidities. Right? Now, there are one endocrinologist for 45,000 people, right? So those one endocrinologists cannot meet all these 45,000 people in a given year. So that means a lot of people cannot see them, right? So what if AI can help to filter who actually needs to be seen the endocrinologist and do some of those initial screening so that they can still get the healthcare they need, but the more complex cares is what the physician is doing. So it's not replacing doctors per se. AI is enabling see who needs the care. So identifying those who needs them, who are critical, and who needs that support is seen by the physician, but most of the other ones can be primarily seen by AI. And AI can be, more powerful in diagnosis settings because of the amount of data that a doctor needs to crunch or evaluate to make a decision. AI can do that much faster, right? So, like example, we have a nutrition engine which can create personal meal plan for millions of people in few minutes, right? Now, a nutritionist can do one person over a period of an hour or two. Even that would be like a general guideline, right? Ours can create millions of people, and you can ask the question to say, okay, one of the meal recommendation is, let's say, cod, no, I don't know, let's say rice or a cod or no salmon. Say, I don't want this for this week, and the AI can immediately change it and have a replacement for you with the same amount of recommended calorie intake. And it can give you even start in a couple of weeks, it can prepare a grocery list for you, right? Now, that's to simplify or help you to do more preventive actions and make life easier for our patients.
Yeah, that makes sense as well, because one of the biggest obstacles to health is the perception that it's impossible to be healthy unless you have to work with very specific and heavy protocols. But in the end of the day, if you simplify it and say, okay, these are the foods I can eat, so let's organize my shopping list. Oh my gosh, I'm not going to sit there forever to prepare. Well, you can use all this software as a doctor, and then as a patient you go home and say, okay, that's what he told me, so you have a special software that does that. But in case some people do not use Friska.AI, they can use something else, and they can see actually if it's actually possible. And just think about the huge amount of chronic obesity, diabetes, high pressure, and all the conditions that we have in the world that could be prevented if we just ate right, if we just exercise, if we just understood we are in charge of our health. And as much as we deny it, we are in charge of how we're going to feel for like 80%, maybe 90% of our conditions, because it's a lifestyle that causes a lot of problems. And then there are the other problems, the hereditary one, the environmental ones. That's where the doctor comes in with medication, injection, surgery, chemotherapy, whatever, but he can put together the lifestyle and all this AI data put together. So if we know how to work with system, we should be able to really be in charge and say, okay, I like this because AI is not there. Maybe it could be biased, like if you have an Italian doctor, he will have his bias. An American doctor might have another bias, or
Mm.
even just trained by a different university. But AI is trained with that database and will just go, right, that's the situation. That's what I'm gonna say. I'm gonna have to hear it. That's what it is. And you can get better. And people will be like, oh my gosh, I can get better. Yes, you can, because now we can integrate your lifestyle, your nutrition, your environment, your emotional health, everything in one place because we're not made. That's the problem with hospital. That's the problem with a hospital. You go there, gastroenterology, one department. Then you
Yeah,
go lung, boom, 2 miles away, if there is a department. And then endocrinologist, another department. But we are all connected. We are holistic people and we are united. We have a soul. We have the energy that we have in our body, the karma, whatever you want to call it. And then we have all these areas and organs. And if one organ is not working, the others are not working well because everything has a cascade. So as long as we keep going just to the specialist, he can only see that. He can't see anything else
correct.
because that's what he's trained. He can only see that. And so it's important to understand AI can be a really good tool to use for a doctor, for a nurse, for a patient. But we have first to understand how it works, which is why I'm doing all this series of podcasts to understand. If you understand it, then you can make a choice. But if you don't, you think you're just an enemy. I just want to see and chat with a doctor. Well, maybe you actually need to get some friends. You can chat with friends. The doctor is not for chatting because you feel lonely. I remember people going to the doctor. I'm talking about 35 years ago when I was in Sardinia as a young girl. And you went to the doctor, there was always the same people every day queuing there. And they just went for the chat. For the chat.
Your friendly neighbor doctor.
Yes, he was adorable. He's still alive. But the thing is, yes, it's good to have a chat with a doctor, but there are other people as well that go there for urgent things. So before we close, is there anything else you wanted to add that can help people to be less anxious about the introduction of AI in the healthcare settings?
Yeah, yes, and yeah, it can only help in healthcare setting, right? As long as you're not talking about robots or those kind of those assisted living, that's a whole different topic, right? So from a preventive and chronic care management, AI is able to help you track your day-to-day data points, your day-to-day measures, whether it's a heart rate, blood pressure, to your blood glucose level, your activity, what you ate, what you didn't eat, and what your health conditions are, how this impacts, and all this data to provide you recommendation for you one. Second, when you go to the doctor, most patients, when the doctor says, have you been active daily? Yeah, I've been walking 30 minutes. But when you look at the wearables, it shows like, 30 minutes the whole month or whole week. Correct? So now the data is more, more correct for the doctor or more. So the AI will help to build patient data intelligence that's beneficial to the patient, that's beneficial to the doctors to provide the right treatment or right care for that patient. So AI will play an important role as a companion. So I could even ask within a couple of weeks, you will have an AI that talks to you on your voice, or you can even create an avatar of your doctor within our system who will best ask you, Shaji, did you have your breakfast? What did you have for your breakfast? You can say, hey, I had my, an apple and I had I had a sandwich. And what sandwich? And then suddenly this is starting to calculate your micronutrients, what carb you ate, what protein you ate, and ability to track it for you, right? Now you don't have to type, you don't have to, measure based on the quantity. So now AI is able to do that. That manual process would take more time, right? So it makes it easier for you to track. Second, it will give you recommendations. Say, hey, your heart rate is slightly high. no, whatever you were doing right now or thinking about it, let's pause, relax, and maybe take a 5 or 6 no second breather and then see the measurement and then do it. So now you have somebody who is always with you to talk to you, and your good old neighborhood doctor is going to be the AI in your hand, which will talk to you, which will listen to you and make it. In our case, I mean, Friska will be your good old neighborhood doctor who become a companion, who you can talk to, ask questions, get recommendations, and will tell you what to do and whom to see.
Yes. It can be quite a life changer for people who live quite far away. Maybe we are in a remote area, they cannot reach the doctor for some reason. And nowadays you think AI, AI. But if you go into your apps, you might have My Fitness Pal, you might have Eufy, you might have something, you go to the scale
Yeah,
without any clothes and it tells you your hydration level, your bone density.
right.
Not quite accurate, okay, that one. But so don't, there are studies showing it's not very accurate. It's quite poor measurement. However, it will tell you your BMI, the amount of fat and everything. All this data every day, together maybe with your fitness pal and whatever. It tell you where you're going. And it's very easy to overestimate the exercise and
Yeah.
overestimate the amount of fiber we have. And
Mm.
maybe after a week or two, we realize, oh, I'm actually not eating enough for
Mm.
my demand of expenditure, or I'm eating far too much. And if I keep going, it shows you the trend. If you keep putting in, it was like one more biscuit a day is 1 or 2 kilos more every year that you're gaining, which for some people might make the difference between being lean and not being lean. And maybe that was their goal. Or the other way, you want to bulk up and feel
Yeah.
better, because AI isn't just for sick persons, it's for people who want to perform well. I
Mm.
want to run better. I want to do a marathon. I want to be faster. I want to be able to deal with all my kids and heavy energy. And then you look at your diet, and the AI might tell you, well, actually, looking at your data, you've been a very high spike of sugar, and that's why you crashed. So, can I suggest something else? So, I think it's eye opening if
Very
we
true.
start tracking some things. It can be a little bit weird because some people track their sleep and they might realize they're actually not sleeping well at all, or they might become anxious about it. So we have to, as usual, personalize and see what's working for you, right?
And it's also that sometimes we don't, there are data points that the physician don't see. Maybe your sugar spiked in the evening, or let's say 8 p.m., and then you're trying to sleep at 10. Could that be because your sugar levels are high? Or is it blood? No, your heart rate went up. There's many
Mm,
reasons behind it, correct?
of course.
But if the patient says, I'm not able to sleep, the physician don't have those data points. Right? From AI perspective, if you're integrating with your wearables and all those data, suddenly you have a more intelligent about the patient, so the doctors can provide more intelligent care for that patient. And so the future from our view looks bright, and more importantly, we think we can deliver care to those people you meant, like in remote areas who don't have access to a physician or a specialist. We can still reach out to them. So we are in the works of it. Hopefully by August, when we launch at a statewide initiative to help those patients who don't have access to specialists to be able to work with Friska. It will be a free tool. They should be able to get access to do preventive and chronic care management. So we are very excited about future developments, the AI
Mm.
capabilities that we are building, and hopefully we talk to you and share some more exciting news in the coming months.
And that's a great thing. I was just thinking how children, for example, they might have a mother or a father who suddenly have convulsions because they're epileptic, or maybe they are diabetic, or maybe even worse, they're on drugs, and they suddenly fall on the floor, maybe they get hurt. The child doesn't know what to do. They can get these AIs to help and tell them, okay, what's going on? We can assess the situation. Okay, call, or maybe can call for you. And while the care is coming, they can keep you like, okay, keep them breathing, put their feet up, do this. So even a small child now, knows how to use certain things, although I kind of disagree giving them. But for some emergencies, you can see how an AI can be quite reassuring as well, and helping you to do things and maybe to unlock doors, etc. Because nowadays lots of people have locks on the door, then can be activated with your mobile phone, etc. So there are lots of applications, and it's really up to us as a population to ask what we need, ask what we want, and then stop what is not right, what we think is going to damage, then go to the parliament, to the government, to the kingdom, and ask the leaders, stop this because that's not good. But if we don't know what it is, we
Correct.
cannot fight it, we cannot use it, we cannot benefit. So as always, education is power. You have to know what you're dealing with.
Very true, very true, very true. And that's a good point in terms of educating, whether it's children or other family members on the health condition. But AI can also do that diagnosis and immediately call the 911 to say, hey, I am down and I need an ambulance immediately, and this is my condition. So the whoever is coming in already have information why this person is down, what is the current health condition, because you already have wearable integrated to say, hey, this patient has high blood pressure in combination with high glucose, and so that's suddenly the reason this patient has fell down. So the treatment becomes much more easier rather than now you take them to the hospital and try to diagnose what has been the problem. So immediately you save 20 to 30 minutes. So imagine if the ER is crowded in any, in the cities, and if you can provide that early detection, early intelligence to emergency workers, you could save 10 to 15 minutes in each trip of diagnosis within that patient, and that can save time within the ER. So AI can be very powerful tool in healthcare deliveries, and with continuous, rising cost, the preventive and chronic disease management is going to be a key area which we believe can make major impact with AI. And Friska.AI is being a pioneer in that space.
That's great. And thank you so much, Shaji Nair. Thank you so much for being in the show and helping us so much to understand how AI, and especially this new app that you got, can really change how we approach medical care and maybe make us feel better. So thank you so much for being in the show today.
Thank you. Thanks, Franz. Appreciate that. And we look forward to sharing some exciting news in the coming months.
Of course. And of course, you guys listening to this episode, I hope you found it useful, and maybe you would like to share it with some of your friends that are really frightened of AI. AI is already here. It's not a robot walking into your room and taking care of you. We're not there, maybe 50 years or maybe 100 years before that happens, but so far, you want to have knowledge of what's actually going on. So you're ready for this, for what is to come. You're ready for this new technology, and you can embrace it or can just leave it aside and go and walk to your doctor and just see that. Nobody will force you, but the doctor will be having less paperwork, less problems, because he will be using this. He is going to be taught at university. It's going to be part of your training as a doctor to use an AI. So let's get used to this and let's find out what is good for us so we can benefit and create the life that we want. So I'll see you all next week. Bye bye.
Bye-bye.